met Jane when I was looking to learn a little bit more about home modifications after brain injury, what their organization is doing, and I was so impressed to hear kind of all of the experience that she brings to the table, and how they're helping people with various challenges or differences after a brain injury, and particularly how they're kind of doing things during this time when it's harder to kind of be face to face with people, and still they're finding different ways to be able to connect with people and help people in their homes. So we're going to switch over the presenter controls, and then I'm going to tell you a little bit more about Jane. Alrighty. So while we do that, Jane is a native of Raleigh, North Carolina. She attended undergrad at Elon University, majoring in human services, and obtained her master's in occupational therapy from ECU. Jane has practiced occupational therapy in various settings, from acute care to outpatient. In recent years, she has become a senior home safety specialist and a certified environmental access consultant. Additionally, she earned the executive certificate in home modifications from USC. Jane and her business partner, Rachel, created Designing Independence in order to provide home modification designs that allow individuals to remain independent in their homes. And so, Jane, if you will share your screen and your PowerPoint, and we will go on and get started.
All right. So as Lauren said, Designing Independence was formed in recent years after Rachel and I had met working as both a physical therapist and an occupational therapist in some of our local hospitals. And she and I together have over 25 years of experience working in various fields. And we just kept noticing that more and more clients or patients kept coming back to the hospital due to having a fall or due to just not progressing in their home due to environmental limitations. And so that's what led us to start the company together. So here is our outline for today's webinar. So a little bit about Designing Independence, which we've touched on already. What the research says about home modifications. Then we'll talk about fall prevention and some everyday considerations. Then I'll introduce a case study. Then we'll talk about medication adherence, energy conservation, and then at the end, we'll have a summary of the topics. So as I said, we have over 25 years of experience, and Lauren has already told you what my credentials are. And Rachel also is a certified dementia practitioner and a certified aging in place specialist. So we have a little bit different certifications and a little bit different backgrounds, but together we feel like we can offer an all-encompassing outlook and create these plans and modifications for people. All right, so first we will look at the research. I'm trying to get this out of my view. All right. So a study titled Home Modification Interventions on Participation of Community Dwelling Adults with Conditions found positive outcomes of home modifications. And those outcomes were increased functional performance. And with that, they mean their ability to perform ADLs, like your bathing, your dressing, your grooming, your feeding yourself. They also experienced a decreased risk of falls and reduced demand on the caregivers. So you might be thinking, well, what is the impact of that? And the impact is that there was a 46% reduction in the need for in-home care, therefore a reduced cost of caregiving and the need for constant supervision by family members. So not only are they decreasing the financial burden by having these home modifications, but they're also allowing for the caregivers to potentially work outside the home and have gainful employment, which can be a big concern for many people, especially after a brain injury, as that person might not be able to work in the same role that they used to be in. but then also have the ability to have some form of respite so that they're not providing 24/7 supervision or care. So next we're going to talk about fall prevention. And you might be thinking, well, why are we talking about fall prevention? And the reason is that fall prevention is one of the leading causes of injury or return to a hospital after being discharged. But it also can be an issue with progressing towards independence. So it's a setback for a lot of people. And when we think about falls, we want to think about what are the risk factors. Generally, risk factors are categorized into 3 different areas. The first one would be environmental. Environmental risk factors are things within your home, like clutter or having potentially poor lighting. Another risk factor is biological risk factors. And so that might be the fact that you have leg weakness, or maybe you have decreased vision. And then the last risk factor is behavioral, and that could be like polypharmacy or taking multiple medications that interact with each other. Or it could also be just being inactive and not pushing yourself to do things every day. And then when you think about your risk factors, you want to think about each risk factor as a building block. And if you take building blocks to create a tower, each fall risk is another block making a higher and higher and higher tower. The taller your tower, the more likely it is to fall over. So on the other side of that, if you can have a shorter tower with decreased risk factors, you're less likely to have a fall. So with all that being said, the 6 steps for fall prevention that were identified by the National Council on Aging are participating in a balance and exercise program, talking with your healthcare provider, reviewing medications, get your vision and hearing checked, talk with family members, and keep your home safe. So over the next few slides, we'll discuss each one of these a little bit more in detail. So as most of you know, every brain injury is going to be different. So not everyone's going to be able to engage in the same balance and exercise program. So an exercise program can be doing gentle stretches with the assistance of a caregiver or a loved one. It could be doing TheraBand from a seated position. Or if someone's higher level, it might be taking walks around the home or outside of the home. In terms of balance programs that you can do, I always like to tell people to either sit or stand and picture that there's a clock in front of them. And think about the 12 o'clock position, 3, 6, and 9. And then you can practice reaching towards each one of those numbers so that you're reaching in all planes. Another idea is to hold on to a stable surface, like a countertop or a chair, and then practice standing on one leg. Or you can also practice just standing with one foot in front of the other or trying to walk in a straight line. So exercise programs and balance programs not only allow for increased functional use of your extremities, but they also improve your endurance and they decrease the risk of injury or need for caregivers. So next, talk with your healthcare provider. If you have a fear of falling, it's very important to express this concern. Oftentimes when someone is fearful of falling, they are less likely to engage in daily tasks or walking or exercising because they're afraid they're going to fall. And it is a valid concern, but it needs to be discussed to help people come up with an action plan to try to decrease that fear. So if it's your primary care physician or even potentially your therapist that you're working with, it's important to express these concerns. And even the caregiver can express those concerns with the therapist. Maybe it's what specific transfers that they're having difficulty with and see if they can come up with an alternative method or maybe potentially using a different type of equipment to help make the transfer safer. All right, so next is reviewing your medications. So as many people know, oftentimes after a brain injury or any traumatic event, there can be numerous types of specialists involved in your care. And sometimes these specialists will each write a different prescription. So you need to have someone who's aware of all the medications that you're taking. And that includes even homeopathic and herbal supplements as well. So sometimes there's the potential for all these different medications to have a negative interaction if somebody is not in charge of monitoring them all and making sure that they're all being used as appropriately. So also you want to make sure that you're taking the medication at the right time or as it's prescribed. So sometimes your medication might say, take 2 times a day with meals, or other times it might be take every 8 hours. And sometimes that can be confusing to figure it all out. And so it's important to take all that information and have someone help make a schedule. Another thing to think about in terms of medication is oftentimes a side effect is sleepiness or dizziness. And as you can imagine, that can increase your risk of falling. So you can always discuss, it might not be an option, but it might be an option to see if your medication could be taken in the evenings when you're going to bed, and therefore you won't be up and walking around. So you also want to get, oh, it says my audio is not working.
Hi, Jane. Yeah, we lost you for a little bit, but I think that we can hear you now.
All right, so I'm back.
Yep, you're back. You can't see your video, which is probably fine. Maybe that'll be better for the audio.
Yeah, it's suggested to turn off the video. So we'll try this option and see if that helps keep y'all to be able to hear me. All right, so the next one is getting your vision and hearing checked. So this is another thing that can vary widely in a brain injury population as well. But you always want to continue to monitor changes in your vision, such as sudden onset blurriness, or even if you have appearance of spots in your visual field. As you can imagine, with decreased visual field or acuity, navigating your environment can be difficult. For example, those with cortical blindness, it's best to eliminate all the clutter in the home, including end tables, ottomans, coffee tables, rugs. If you or your loved one have experienced visual impairments, you might also want to consider using consistent lighting throughout the home. And what I mean by that is as you move from your bedroom into your kitchen, you want the lighting to be somewhat consistent so your eyes don't have to take the time to adjust from dim light to bright light. You can also use various forms of lighting. So overhead lighting, track lighting, pennant lighting. You can put lights on dimmers or task lighting. So you can use it to direct the light directly onto a hobby that you might be engaging in. And also think about lampshades. Can you use the shade to direct the light out of your eyes and towards something else? When outside, consider using sunglasses or a hat with a brim to help keep the direct sunlight out of your eyes. Glare is another concern for a lot of people. So if you think about shiny floors and sun coming in, it can be very bright and distracting as you're trying to get around your home. So think about having adjustable window treatments that are easy to access so they can be opened and closed depending on the time of day and the direction of the sunlight coming into your home. If there's any uneven surfaces in your home, always mark them with a bright colored tape to help alert to the change in height. That's also a similar concept to if you have commonly used buttons throughout your home, like on the microwave or the stove, you could put a bright piece of tape or a sticker to help alert which buttons you're going to be using. So in terms of auditory information, a lot of times auditory information is what keeps us safe as we navigate our community, such as hearing a fire alarm or knowing a car's coming by hearing their engine coming down the road. So you want to consider alternative alert methods, such as vibration or flashing lights. Other people might be sensitive to sound, and in that case, you can consider using noise dampening panels or even heavy drapery to cover windows, which might help keep some of the external noises out of your home. All right, and now, so talk with your family members. Let your family members and your friends know about any fear that you have of falling or any concerns that you have with your daily life, such as getting groceries or just the need for social engagement. A lot of times, family and friends want to help, but they're not sure how to help. So, having that conversation can help with mutual satisfaction for all of you. We always suggest creating a team of trusted caregivers that have consistent communication. So make sure you're labeling things like medications or using a set schedule. Oftentimes, after a brain injury, consistency can be key. So the last topic within fall prevention is keeping your home safe. And a lot of these things I've already touched on a little bit, but the general tips include reduction of clutter in your home, open walkways and doorways, removing throw rugs, consistent lighting, ability to control the glare from windows, keeping things organized, and then place commonly used items within easy reach so you don't have to reach up high in cabinets or low into a drawer. And then always think about picking out simple patterns when you're looking at countertops and flooring or carpeting options, as busy patterns can be more confusing for a lot of individuals. All right, so far we've talked about designing independence, what the research says, fall prevention, and everyday considerations. And so now we're going to move on to a case study. So far I've touched on a lot of general recommendations. And as I've said, no two brain injuries are going to be alike. So what works for one person or one family might not work for another person and another family. We always want to consider the person's functional status in terms of mobility and their ADLs, as well as their cognitive status. We also need to think about the family and their current home setup. Some people will opt to do a large renovation when they bring their loved one home. Other people may opt to move to a more suitable home. And then other people are going to make the best of the space that they have. And that might mean that they clear out all their living room furniture and place a hospital bed and any necessary equipment right there in their living room so they can be there to help their loved one. So in this case study, we do have permission to use the images that you'll see. Not all of the images come from this person's home. But some of them are, but then we also changed her name to protect her privacy. So meet Amy. Amy is a 35-year-old female that was injured in a car accident. She suffered a TBI with diffuse axonal injury. She spent several months in the acute care hospital and various rehab programs before her family wished to bring her home. So we were contacted in order to help determine the home modifications that would be necessary to make it a safe and accessible environment for Amy. So at the time of discharge, she had limited use of her right leg and right arm. She required assistance for all of her ADLs. She was able to take food by mouth, but not yet self-feeding. She could stand for a limited amount of time using an AFO or otherwise used a wheelchair. When she was standing and taking steps for transfers, she did use a platform walker and a gait belt. In terms of her cognitive status, she was alert and oriented and able to do one-step tasks, but unable to do multitasking or higher level problem-solving skills. Additionally, she is sensitive to bright light and noises. Okay, so here we are at Amy's home. It's a 2-story home with a 2nd floor master. The garage had 2 steps to enter without rails, and the front entrance was 4 steps with rails. So our solution in this scenario was she's going to use the lower floor bedroom and bathroom, which is a very fortunate situation that that was already available to use. We added a temporary ramp to the front of the home at a grade of 1 to 12, excuse me. And then we placed a threshold ramp to go from the porch into the front door so she could have a family member assist her in the wheelchair into the home. While in this home, the doorways were wide enough to allow for a wheelchair to get in, many homes do not have wide doorways. And if you come across that, especially with interior doors, you can always consider the use of offset hinges, which will add about 1 to 2 inches of width for getting in and out of the doorway. Typically, you need about 32 inches in a doorway to accommodate use of a wheelchair. And that's even somewhat on the tight side for a lot of people. All right, so here is the living room. And in this case, we wanted to place all the furniture to have wide access for walking around, the caregiver, as well as bringing the wheelchair in and out of the room. As always, reduce the clutter as much as possible. And this room does have hardwood floors, and the carpet or the rug is a very low pile. So as of right now, in the wheelchair, it's not a problem. But we did discuss that in the future, if she's walking more with the walker, it's best to go ahead and remove that rug at this time. We use the armchairs that you can see over on the right because they're a firm and higher sitting surface, but also the arms are not too tall, which allows ease of transferring in terms of clearance space, but also narrow and allowing her to use her arms to help push up when sitting or standing. The window treatments are easy to move up and down to block out some of the light. However, there are the transom windows above the 4 on the left side and then the 2 over by the bookcase. So we did suggest adding additional coverings to those or even tinting the windows as well. And in this case, we did leave the ottoman there in the middle because it's on wheels. And so it's easy to roll out of the way, but then also be another functional place for her family to come and sit and be with her and be present. And a lot of times we like this ottoman option because it's a soft surface, which can reduce the risk of injury in comparison to having a coffee table with sharp corners or edges, if there were, in fact, the event of a fall. All right, so next is the kitchen, or what I call the family gathering place. Access to the kitchen as well as the family room can be equally important as having a private and well-suited bedroom because so much of daily life is occurring between the kitchen and the living room. I think it's always important for someone to have a place at the table, so to feel welcome to come and sit at the table and do meals with their family members. So you want to make sure that the table height is appropriate. And then in this case, the pedestal table is a great option because the legs are centralized instead of being out to the side, which can get in the way of using a walker or a wheelchair. At this time, she's not preparing any meals, but she has expressed the interest in being able to help. So we suggested, with the help of the family, to use a drawer with easy access. So it's actually right on the other side of the closest chair, so she doesn't have to go fully into the kitchen. And it has a drawer handle instead of a knob for easy grasp to pull it out. And that gives her independence and autonomy. We also had Amy using Dyson under her plates to decrease the plate from sliding around on the table as she begins attempts to self-feed. And with forward thinking, we chose to discuss appropriate utensils for her. So we're looking at wider handled utensils that are easier to hold onto and manipulate. We suggested switching out all of the plates and cups that she'll be using for non-breakable items, therefore not to cause any damage or potential injury if they were to break. And with cups, having one with a large handle was easier for her to grasp. That's also lightweight, so to reduce the work of bringing that cup up to her mouth. We also suggested use of straws too. So the kitchen remains free of rugs. It has a wide open space for her wheelchair. And then as well with the lighting, there's various lighting options in this kitchen as well, with overhead lighting and the pendant lighting. We suggested putting the pendant lighting on a dimmer so that she can have time without bright light shining in her eyes while she's eating. And similar to the family room, these same window treatments are here that can come up and down easily, but then also suggested covering the higher windows as well. Depending on clients' needs, the kitchen can also be a great place to store medication. So using an open, free of clutter countertop space, or even a big board, like a family communication board in this area, to put medications and have her medication schedule there for everyone to see. And you can even keep the medications in a locked cabinet if necessary, but we'll touch more on that when we get to the medication adherence section. All right, so in the bathroom, so we had a 0 entry shower installed, so meaning that there's no lip or nothing to step over to get into the shower. The door swings either direction based on the needs. And Amy, in this case, was able to use that built-in seat with her family assisting her. However, that might not be an option for everybody, depending on trunk control and other needs. So you can always consider the use of a standalone shower chair or even a roll-in shower chair option. For other people that need kind of a more temporary solution, there's even portable shower options that all you need is access to water and a GFI outlet. So we've even had people set those up in their garage so they don't have to worry about finding a place for the home or doing major renovations. Consider your shelving or your storage options. So you want to make sure that all the necessary items for taking a shower are within easy reach. And sometimes it's best to just have one bottle of shampoo, one bottle of conditioner, one bottle of soap, and not have multiple options that can be confusing. Make sure they're in easy to open containers. Some people will like to use soap on a rope or a long-handled sponge to help with increased independence when doing their bathing. Also, we added traction strips in front of the seat as well as on either side of the door to help decrease the chance of slipping or falling with the wet surface from the water. Also, there's a spray-on surface on the tile that helps decrease the sheen and provides more traction when walking in the bathroom. And then in general, smaller tiles that have more grout tends to provide more traction than having really large, sleek-looking tiles. So she has a handheld shower head as well. And in a shower of this size, you usually need at least a handheld shower head that's 69 inches long to be able to use it comfortably in all areas of the shower, as well as thinking about the placement of where you're going to put that handheld shower. So in this one, it's actually kind of in the middle. And I'm sorry, that picture is not the best to see where it goes, but that allows it to be a little bit more functional to use from the seated position on that built-in seat. I always suggest the shower heads that allow you to turn the water on and off from the handheld component. That way you're not spraying yourself with water unnecessarily or using water when you don't actually need it. And grab bars are always a great option as well to help stabilize yourself when sitting or standing. In this case, there's one with the handheld shower head, and the family decided not to add any additional ones since they are getting in the shower with her. But as she progresses, it's likely that they will need an additional grab bar. I always think about the way your entry door into the bathroom opens. Oftentimes, the door opens into the bathroom. However, if someone were to have a fall and potentially be near the door, now they're blocking the door from being open to be able to get to them quickly. So you can change the hinges and have the door open into the room as long as the room allows for that. And that can be a much safer option for many people. So with toileting, Bidet attachments are becoming more and more common. They just attach right onto the toilet. And these are great for people that are continent, but not necessarily able to coordinate or thoroughly perform their toilet hygiene. And in Amy's case, we did have to put in a higher toilet to make it easier for her to sit and stand. Many people will opt to use the 3-in-1 commode, or some people call it a bedside commode, where you can take the bucket out and place the frame over your toilet. So that will give you increased height and also the use of the armrest to help stabilize when sitting or standing. Alternatively, you can add grab bars in various positions based on where they're going, whether that's vertically, horizontally, or diagonally, to help with sitting and standing if the 3-in-1 commode is not an option. Some people will choose to use their 3-in-1 commode at their bedside for nighttime toileting so they don't have to wake up a family member or travel long distances to get to the bathroom at night. Another feature that we did in Amy's home was we added a light onto the toilet bowl so that when she is toileting at night, it helps with additional lighting to see where she's going. Some people also like to use motion activated lights that come on when you enter the bathroom. So you're not having to worry about reaching the light switch or remembering to turn it on if you're in a hurry. All right, so having a vanity place is valuable to be able to perform your grooming tasks and also store items that you're using on a daily basis. There's various options of wheelchair style vanities that are on the market. Many of them do not have any storage space below, so we like this option, and it's hard to tell from the image here from the front view, but from the side view, it does have a slope, so it allows for foot space to be down at the bottom, while also having some cabinet storage for personal items as well. And it can be mounted at various heights based on your individual's needs. So thinking about, are they going to stand up for part of their grooming routine, or are they going to remain in a seated position the whole time? Or do other family members use this bathroom too and need it to be functional for them as well? Consider adding the faucet extender, so therefore the water coming out can be directed closer to the bowl or towards the edge of the sink, which makes it easier to perform hand washing or oral care from a seated position. Also, adding the extended levers onto your on-off or hot-cold portion of your sink can be valuable for reaching from a seated position. And Amy's mirror was placed on hinges so that it can be tilted to allow her to see herself while combing her hair, or eventually, putting on makeup or putting in contacts. All right. So in the bedroom, so this is not Amy's actual bedroom, but in this case, it's very similar. So we suggested the hardwood floors. And anytime you're using hardwood floors, you want to make sure that the individual is wearing either non-slip socks or stable shoes so that they're not slipping. But it tends to be a better surface than having lots of rugs or carpeting when using a wheelchair or a walker. And in this case, if this were her room, the space between the wall with the windows and the bed is too close to really maneuver, assist a device appropriately. So you would need a smaller bed in this case. And then, so on her nightstands, we did add corner guards because they're sharp. We didn't want to risk rolling over into those corners or potentially a fall into those corners. And we added a bed rail to keep her from rolling out of bed at night. Her lamps were changed to touch on or touch off lamps, so she didn't have to manipulate the small knobs for turning it on and off. We added noise dampening panels into her room due to her having sound sensitivity, and also curtains and drapes to help with the noise as well, but also to help with the light control. We painted her bedroom in calm, relaxing colors, so it could be more of a personal retreat for her to have respite and work on her healing. Upon entering the room, we always want to think about where is the light switch and is it in a place that she can reach easily. So we added light switch extenders. All right, so medication adherence. So I've touched on medication a couple times in different parts throughout the webinar. It's always important, like I said, to take it as prescribed. There are numerous systems out there that work for taking your medications appropriately. So some people are going to opt for a very simple pill box that's filled by a loved one on the same day each week. And it might only have one compartment per day. It might have 2 to 3 compartments per day. Other people are going to need a more complex system. And there's various ones out there that have audible timers. So to remind you, it's time to take your medication. Sometimes the compartment with the medication will light up, so you know which one to dispense. Other times they'll have all locked boxes except for the one that you need to take. Some of them allow for multiple caregivers to access. Some of them are single caregiver access only. Alternatively, some people like just a very simple calendar or paper and pencil option where they can go and just mark off each dose that they've taken so they don't forget, like, did I take my morning medicine or did I not take my morning medicine? Another one that many people like are the pill packets. So this is when all your medications are sent out to a pharmacist. They create individualized packets per time frame that you need to take it. So you'll receive back a bunch of small plastic containers or little baggies, and it will have the date, the time, and all the medications that you need to take at that time. And everything is inside. You just open it up and take it. So this is a great option if you don't necessarily have a loved one that can organize your medications for you. However, if your medications are changing often, it can be burdensome to try to get it corrected or not waste medications that have already been put into these pill packets. In Amy's case, it was not suggested for her to manage her own medications at this time. And as I mentioned, the family used her kitchen as the storage space, and they actually kept it in a childproof or in a cabinet with a childproof lock. And a lot of people will use the childproof locks for other things like sharp cooking utensils or alcohol or just things that they don't want their family members to have access to when not thoroughly supervised. Another topic to think about is energy conservation. And this is important for everybody, whether it's a brain injury or another chronic condition that you might be living with, such as COPD. Just it's using the amount of energy that you have for the most critical part of your day. And the reason I bring this up is because healing takes a lot of time and patience. And if you find yourself overdoing it, you might experience setbacks, both mentally and physically. So we always suggest enlisting the help of others. Share your concerns with a neighbor or family member and see what things someone else could help you with. So maybe it's having your groceries delivered to your home instead of trying to get them from the grocery store. Maybe it's even getting your trash cart to the street. It's too heavy for you to manage, but your neighbor's young and healthy and willing to help you, and so they can do it for you. Other suggestions are always coming to the table to eat your meals, as sitting upright can help with breathing, but also digestion. So if you feel the best in the morning, do your hardest part of your day in the morning. Or if you know that going to a doctor's appointment is just really going to wear you out, try to schedule your appointments for the morning time so that then you have the later time in the day to rest and recover from that. If you are able to plan ahead and organize your home or organize the things that you need for an upcoming appointment, you'll find that you're not rushing and get scattered, which can also lead to increased anxiety, but also can lead to increased risk of having a fall because you're rushing and trying to get things done at the last minute. So technology is another topic that comes up a lot with the brain injury population. So it's an excellent option for increasing your independence. Many people like to use voice activated programs or even a lot of the new smart home programs, because these can limit the need for additional caregivers involved in your daily care. For example, they can help you keep up with your calendar, upcoming appointments, or even provide you with simple prompts such as what day it is, what time it is. Technology also allows for a lot of people to have recreational or social outlets, especially like now where many of us are doing meetings all from our computers. And it helps with communication for people that might not be able to communicate well. They can use different communication devices. Some caregivers really like using an existing home security system that has a chime feature. You can put on your chime and that will alert you that your door is being opened and closed. Or even using things like Arlo cameras or other brands where you can monitor your loved one from another room or from another area. Bed alarms, doorway alarms can also be added if you have a loved one that tends to be impulsive or wanders from the home. Maybe forgetfulness is something that you struggle with. I know I'm guilty of this as well. I think, oh, did I turn that off before I left the house? So auto off outlets can be used to help turn off appliances at a set amount of time and not risk potential fires. There are a lot of watches on the market that offer GPS type tracking services. Many times these are advertised more towards the Alzheimer population, but many of them are very useful for anybody because they can offer medication reminders, fall detection, heart rate monitoring, and you can use apps to track a loved one. With those, if you are concerned about wandering, you might also want to make sure that the watch that you choose has a lockable feature so that they cannot take the watch off and then make the app lose its purpose and function. All right. So as I've said numerous times, traumatic brain injuries are going to affect everybody differently. And this presentation is not meant to be all-inclusive in regards to all the options that are available to create a safer and more accessible environment. So as a team, we're able to design and create numerous options to meet sensory, cognitive, and environmental needs. To summarize the key considerations you want to think about if you're going to be at home after a brain injury is to have a safe entry and exit plan, especially in the event of a fire. Reduce your clutter and the rugs in the home. Make sure you have an accessible shower space. Have an appropriate toileting method. Consider the height of your furniture. So how high is that bed that you're going to be getting in and out of? How high is the couch or the chair that your loved one might be sitting in? Do you need additional equipment? Maybe that's the bedside commode in the bathroom or beside the bed at night. Maybe a transfer system such as a Hoyer lift or a track system or even a Serra-Steady to make transfers easier. And then what technology could be beneficial for you and your loved one. So here I included some of the other services that Designing Independence offers. So that is aging in place consultations, pre and post-surgery consultations, accessibility consultations for home and office, adaptations for decline in vision, hearing, cognition, and more, as well as educational seminars. And here are just some of the articles that I used to create this presentation. And then this is our team. So I'm the one here on the left, an occupational therapist, certified with certificates in home modifications, senior home safety specialist, and certified access consultant. And then Rachel Blackwood's a physical therapist, certified aging in place specialist, and a certified dementia practitioner. And then here is our contact information if anybody has any further questions.
Excellent. Thank you so much, Jane. That was really informative. And I really liked how you talked about sometimes you think of home modifications as the big things, changing your entire home, but it's even, finding the right table to use to be able to be as accessible as possible. So thank you for that. If you have any questions as participants, if you have any questions, feel free to put some in now. There was a comment, an additional resource that might be available to you is through the Independent Living Rehabilitation Program. It's a statewide function through North Carolina, and they can provide residential and vehicle modifications for eligible individuals as well. Really getting some praise for you and your presentation. We have a question about particularly surrounding funding. Is this funded particularly through the homeowner in your experience, Jane, or what other types of funding are available that that you've seen to be able to fund things like home modifications?
So generally, yes, Designing Independence is a private pay company at this time. As of right now, it is not considered a service that Medicare will pay for. Sometimes Medicaid will pay for home modifications depending on the needs. But then we've also had several clients that will search for grant money, and many times they can find funding through different grants and other programs.
Excellent. We have a comment mentioning the ILRP. Assuming that's the Independent Living Rehabilitation Program. That's also something that might be able to fund residential and vehicle modifications with state-funded dollars. There's also, if you are in the currently in the Alliance waiver area, which the TBI Medicaid waiver, if you've not heard of it, is a specific program to help individuals engage in the community if you sustained your traumatic brain injury after the age of 21. And that also includes opportunities for home modification if you're eligible for Medicaid and live in the Wake, Durham, Johnston, and Cumberland counties as of this point. Jane, do you have any recommendations for what type of grants you would search for? Are they specifically for, would you just search in home modifications grants, or is there some sort of buzzword that we can kind of share out there for people to be able to look into?
Unfortunately, during most of my research with looking for grants, there has not been a great buzzword for searching. It's been a lot of just finding, a lot of times it's private people that just offer grant money towards any sort of healthcare related needs. And many of them have not restricted home modification, so it can fit under that. But no, unfortunately, there's not a lot that's specifically or only for home modifications.
All right, thank you. And so where do you find is really the best place to start when you're kind of looking into the home modification process? You mentioned so many great ideas and techniques in your presentation. Is there some place for someone to really kind of, all right, this sounds really great. How do I get started?
I just want to clarify, do you mean if you're somebody who's in need of home modifications, or do you mean more of like a professional to gain more knowledge about it?
Maybe both.
Okay. In terms of you're an individual that needs home modifications for whatever the reason might be, some people just simply want to plan to be able to stay in their home as long as possible. I always think about what are the main parts of your home that you absolutely have to access. And many times that's the bathroom, a bedroom, likely the kitchen, likely a laundry room, and maybe a family room where you can do entertainment or respite. So think about those main things, and then always think about a safe entry and exit. And I would just look around the home and say, what can I do to make things less cluttered, get rid of any potential accident hazards, and then go from there. If you're wanting to do renovations, I always suggest to reach out to somebody that has training in home modifications. So that could be anybody that's like a CAP certified, which is certified aging in place specialist, or a certified environmental access consultant, or someone that has the executive certificate in home modifications. And the reason I say that is if you were to just go the handyman route or a general contractor route, not that they won't have great ideas, but they likely don't have awareness of disease progression or adaptations in terms of how to change the way you're doing things, or just simple equipment that could be added without having to spend $10,000 on changing a major part of the home for one reason. So that would be my thought process in terms if you're wanting to make the changes to your home. If you were a professional interested in getting more into the home modification aspect, I would likely look into one of the certificate programs that are out there. Like I mentioned, the certified environmental access consultant, or maybe certified aging in place specialist, or doing the certificate through University of Southern California, just to kind of get your feet wet and see what it's really all about and if it would be a good fit for you, or even shadowing someone like myself or Rachel and going and doing a home visit with somebody, you know, seeing if that's something that would be of interest, I think. So.
Excellent. We have a comment coming in regarding back to funding. First in Families is another resource here in North Carolina that is able to provide funds for individuals with disabilities, typically one-time funding, depending on need. And so you can go to their website. It's www.fifnc.org, and I can put that in the chat as well for everyone to be able to utilize. We have a question here. So if someone is coming home from the hospital, can a case manager link with someone up with an OT, occupational therapist, and or a PT, physical therapist, in order to do an assessment for functional needs to support that kind of transition?
Absolutely. So we, at this time, are not connected with any specific case managers in hospitals. We've done a lot of work with more like senior case management, like private hire kind of things, where people will consult us to help with getting people home. But that's actually an excellent resource, is having a case manager reach out. And there are a lot of home health companies that will do home safety evaluations, and it's generally the occupational therapist. A lot of times what we've seen from that, from our own experiences and colleague experiences, and even some of the clients that we've worked with, is that it's a very basic checklist system. I'm more of like, okay, you need to move that table out of the way, take the rug out here. You might need a ramp to get in the home. It's not necessarily looking at the whole working function of your daily routine and your individual needs. And sometimes it's more of a short-term kind of temporary solution, whereas we tend to look beyond the checklist and can do a more whole person, individualized plan.
Excellent. Yeah, that goes into one of my other questions. You know, how does a person's goals and needs really come into play when you're determining those type of modifications?
Sorry, I lost part of the audio. Will you repeat that question?
How does a person's, you know, goals and needs come into play when determining, you know, modifications or anything that they might need?
So a lot of times, you know, we will speak with the individual as well as potentially their family member. And a lot of times we are a little bit restricted in terms of who's the one reaching out to us and who's hiring us, on who we have to do most of our communication with. And sometimes the family member and the client might not have the same goals and needs, or have a disagreement in the financial aspect. So all those things have to be considered. But generally, the goals that we're thinking about most importantly is safety. You know, how can we prevent this person from falling? How can we prevent further injury to this person and or their loved one? And then we go from there, and we really want to know, how do you perform your daily routine? Do you like to just do a sponge bath standing by the sink, or do you want to be able to get back in the shower? If it's somebody who just does a sponge bath at the sink and that's what they've been doing for 10 years, then there's absolutely no reason that we need to renovate their shower. Because that's an unnecessary and almost unethical reason to make that suggestion. So we try to get a good picture of what their thoughts are, how long do they want to live in this home, and then we're also taking into account what is the diagnosis and what does the progression of that look like, because I don't want to recommend somebody has a stair lift to their second floor when I know that they're going to lose trunk control in the next 2 months due to an ALS diagnosis or something. So it really is, it's a lot of big picture and a lot of individualized concerns as well.
Yeah, that's definitely good to keep in mind. I wondered, is there a significant kind of like follow-up process that you take with individuals? I know that there's a lot of times where progress is so individualized and everyone's kind of on their own journey after brain injury, and the first thing that you try might not be the best fit. Can you describe that kind of problem-solving nature that either you've gone through or maybe advice to give to our participants?
So in terms of follow-up for designing independence, we have left that open to each individual client. We are always here for follow-up questions. We offer to come back into the home after modifications are complete to do training. We want to make sure they understand the use and how to use it, purpose for it, and make sure it's a good fit for them too. So we offer that. However, we have some people that prefer not to have us come back, and that's okay too, because they want to, jump right in and try all things out, and maybe they just send us an email or a simple phone call to ask questions for follow-up. So it's not a set way, and part of that's because we are private pay and we're not insurance, so we don't have to have documentation of follow-up at this time. So it's an individualized situation.
Excellent, thank you. What would you see as the most challenging aspect of trying to find the right home modification, or maybe something that's just a little bit different specifically for individuals with brain injury?
I think overall, the hardest part, is just you can't generalize things because everybody's going to be so different and their needs are going to be so different because they can present so differently in terms of physical capabilities as well as cognitive status. I mean, you've got the potential for, lack of impulse control. And so is that person going to defy the fact that there is a railing on the bed or that you have an alarm set up to notify you that they get out of the bed or exit the doorway? And provide a great cohesive plan when not everybody's going to work out the first time with what we suggest. Sometimes it is going to mean, okay, that didn't work, so let's come back with option number 2. And sometimes it might be option number 3, and it's just going to be a lot of trial and error until you find what works best.
Excellent. Yeah, I think that's true for a lot of different things, the different trial and error. And I like that you also talked about that everyone is so different. So, we talked a lot about a lot of different changes that you could make, but if you have a more, milder effects after your injury, or maybe you just need a few different adjustments, that's potentially an option for you too. So I like that. There's a lot of variability no matter who you're listening, if you're an individual, family member, or professional. You might even be able to take these tips and change your professional workspace as well when you're taking in individuals or talking with them. We do have a question just asking if this webinar will be downloadable so that they can share it. Yes, so you won't be able to download it, but you will be able to view it in the follow-up email. You'll get a replay of the recording, and then you'll also be able to access it on our website. By the end of this week, we'll have that available to download or to view at least. I had another question that I'm trying to think of what it was now. When it comes, Jane, when it comes to technology, I know that that's one of the most challenging things to be able to grasp, because it kind of is a habit to be able to learn technology, learn how to use it. Do you have any recommendations for kind of that training process of maybe someone has never used, technology before, and how that works with kind of ingraining it into the home?
I'm sorry, I'm having audio problems again, but I think you were asking what's a great method maybe for helping someone who's not generally using technology and how to get them to use it better?
Yes. Yeah,
Okay.
that's perfect.
So I think it depends on what it is. And the reason I say that is, there is assistive technology resources out there. So if it's more for like a communication, I would recommend visiting one of those places and trialing out different things. And, they have training on how to use them all. Will train the individuals and help you with trial periods, and you can exchange them as needed. If you're thinking more in terms of like the Google Home setup, things like that, we actually have worked with another company, and I'm blanking on their name at the moment. I will think about it. They basically specialize in technology for seniors. So they can come in and help you set up your home using all sorts of different smart home technology. His company is actually the one where I learned about a lot of the different GPS watches. He has programs that help notify you of onset of potential UTIs. I mean, it's very all encompassing in terms of the different options that are available through him. So I generally would, he doesn't have to be him, but I would recommend utilizing a company like that. And even though his market is generally towards seniors, it does not mean that it does not apply to numerous other types of people that could benefit from it.
Absolutely. Yeah. Whenever I'm looking at different resources or information for how to modify homes, I'm looking at individuals that might have attention hyperactivity deficit disorder. I'm looking at seniors. I'm looking at other types of medical challenges or needs for individuals. So I highly encourage anyone out there that's looking for information. Maybe you're not finding everything you need in a specific brain injury field. There's so many other groups that would be able to translate that information. So I'm glad you brought that up. Another resource for the assistive technology that you mentioned is the North Carolina Assistive Technology Program.
Yeah.
They can help with the assistive technology, and I'll link them in the chat. One question that we had, Jane, was do you need a physician's order for the modifications, home modifications, or anything like that? Jane, are you able to hear me? We might have lost Jane.
I've lost you. Do you
Oh,
hear
okay.
me?
I can hear you now. Can you hear me?
Yes.
Wonderful. So do you need a physician's order for modifications typically?
Not in our case. So no, we do not need a physician to do any referral at all. We have people that contact us just because they want to plan for the future. And we have people that contact us saying, my mother-in-law is coming home from rehab in 1 week. What do I do? Help me, please. So there doesn't have to be an order at all. So that's a positive thing as well, especially for someone who's maybe doing more planning versus an immediate need.
Excellent. I think those are a majority of my questions.
I can say too, conversely to that is if you were going to have a home health therapist come into your home, yes, there does have to be an order in order for that to happen.
Yeah, but likely depending on funding or anything like that, that would make sense. So before we kind of wrap up, if there are any additional questions, please put them in now.